Why is FTD less known than Alzheimer's? Have you ever wondered why frontotemporal dementia is not as well known as Alzheimer's disease? This question is important because understanding these differences can help improve awareness and care for those affected. Frontotemporal dementia, or FTD, is less recognized primarily because Alzheimer's disease is much more common. Alzheimer's is the most prevalent form of dementia, especially among older adults, and has been studied for a longer time. This means that when people think of dementia, they often think of Alzheimer's first. One major reason for FTD's lower recognition is its prevalence and age of onset. Alzheimer's disease typically affects people over the age of 65, while FTD usually begins in a person's 50s or 60s. Since dementia in younger individuals is less common, FTD is encountered less frequently. In fact, FTD accounts for only about 10 to 20% of all dementia cases. The symptoms of FTD also play a role in its obscurity. Early signs of FTD often include changes in behavior, such as socially inappropriate actions, apathy, or impulsivity. In contrast, Alzheimer's usually starts with memory loss, which is a symptom that many people recognize as a sign of dementia. Because memory loss is so widely known, it makes Alzheimer's symptoms more immediately associated with the disease, leading to a lack of awareness about FTD. Diagnostic challenges further complicate matters. The symptoms of FTD can overlap with those of psychiatric disorders or other neurological diseases. As a result, many patients with FTD are initially misdiagnosed with Alzheimer's, psychiatric conditions, or even Parkinson's disease. This misclassification can reduce awareness and reporting of FTD cases. Historically, Alzheimer's disease has received much more attention in research, public health campaigns, and media coverage. FTD has only recently started to gain recognition, and currently, there are no treatments available that can slow or stop its progression. This lack of treatment options may limit public interest and awareness. Additionally, the complexity of FTD, with its various forms affecting behavior, language, and personality, makes it harder to communicate about compared to the more straightforward memory loss seen in Alzheimer's. Public awareness and education also contribute to the differences in recognition. Since Alzheimer's disease is more prevalent and typically presents with memory loss, it dominates both public and medical awareness. The early symptoms of FTD, such as personality changes and language difficulties, are less commonly linked to dementia by the general public, which adds to its lower profile. In summary, frontotemporal dementia is less known than Alzheimer's disease due to its lower prevalence, earlier age of onset, distinct symptoms, high rates of misdiagnosis, and less focus in research and public awareness. Understanding these differences is crucial for improving early diagnosis and care for individuals with FTD, especially since its symptoms often affect behavior and language rather than memory loss at the outset.